year PhD student undertaking research on kidney stones here at Betsy. I'm looking at a particular surgery, flexible ureteroscopy, and complications that happen post-operatively and managing those. My research involves clinical aspects as well as scientific aspects. We are responsible for recruiting all of our own patients, so we go up to the wards, we recruit patients for our studies. I do kidney stones and Rebecca does bladder studies, and then once the patients are happy to be involved in the study, we take blood samples from them at various time points in order to measure different hematological or inflammatory responses. At the moment, research within urology is quite limited, so we're hoping to set sort of the ground level research in the area, and then from that we're hoping to enhance research in the field, promote further research in the area, and then specifically from my project I hope to enhance practice. I think that by providing information on normal post-operative responses following surgery, that we might be able to use that as a comparison point in order to identify patients at risk of post-operative complications. So that's sort of the aim of it. Obviously that's like a 2 to 3 year plan. It'll probably involve postdoctoral research as well as undergraduate PhD stuff that we're doing now. But it really is setting the stage for further development within urology, within research within Betsy. I found it really good. I enjoy the mix. I like the fact that we're not just confined in the lab all the time. Do you agree?
Yeah, definitely.
The fact we're not just here, I mean, I like Rebecca, but having other doctors to work with, consultants to work with, and I think it takes away that hierarchy system that I think a lot of people are afraid of within medicine. Like the consultant I work with is very good, he's very approachable. I know that I can speak to him about my scientific concerns, or that he can give me the relevant information that we need in terms of the clinical bits that we lack with our science research. So I think together the whole picture knits together really well. Yeah?
Yeah, it definitely does. It helps to bring sort of the science from the lab bench actually to patients and actually their care, because obviously it's very sort of science on one side, clinicians on the other.
Yeah.
But with the help through this research, it's actually bringing the two together and collaborating more, which equally brings out a better sort of positive result, both for patients and for research.
Yeah, I guess that's why we do it, isn't it, really?
I'm Rebecca Lamb, and I'm a first year PhD student with the University of Chester, and an honorary contract with Wrexham Mailer. So again, I come to Wrexham Mailer, I recruit my patients, but I look specifically at inflammatory markers and hematological markers for those patients who undergo surgical treatment for non-muscle bladder cancer. So slightly different sort of procedure to Alison. It's a different cohort of patients as well. It's a lot more older, so generally over the age of 65. But again, it's nice to sort of have that experience of being able to speak to patients one-on-one, but go through their experience with them, and when they come out the other side and there as well, again looking at both the clinical aspects for them, but also doing research based. I like being in a lab, I like getting behind, petting things, having the data at the end of the day. But again, I think with being able to recruit my own patients and having that link with clinicians, it's given me the best of both aspects, which means I'm not just stuck in a lab all day, or I'm not just stuck recruiting patients all day. I've got the best of both worlds, so it's nice to have the variety. I definitely recommend anyone